Hi, I'm Justin from Back in Motion, and today we're going to cover off on some of my favourite myths about low back pain. Myth number 1, low back pain is an old person's problem. Well, in actual fact, 85% of the population will experience low back pain at some stage of their life. Regardless of how many candles were on your last birthday cake, I explain to my clients that it's more a matter of when, not if, and there's never one single reason for low back pain, but rather a number of contributing factors. It's our job as physiotherapists to identify all these contributors and address them accordingly. Myth number 2, strength will protect your back. Obtaining or maintaining strong core muscles does help prevent low back pain, but before you strengthen what is weak, you must reactivate what is inhibited and stretch what is tight. Myth number 3, an MRI or other imaging is required to diagnose my low back pain. Fact, a successful treatment plan can be based on a thorough medical history and physical examination. Most imaging will display problems that may not actually be generating any pain. As such, it's important to treat the person, not the scan, and use imaging to get a gauge of the severity, and typically I'll only refer for further imaging if the patient's not progressing at a rate that I would expect or looks like they might need an opinion from a surgeon. Myth 4. Sit-ups are safe and will strengthen my back. Fact. Traditional sit-ups use more of the hip flexor muscles. Tight hip flexors can place excess load on the lumbar spine. In addition to this, sit-ups bring the lumbar spine into flexion, which puts increased load on the disc. In fact, a recent study of intervertebral disc pressures showed that performing traditional sit-ups exceeded the recommended safe loading limit for occupational health and safety. Myth number 5, increased flexibility is beneficial. When seeing patients with low back pain, I like to break them down into what I call stiffies and floppies. Stiffies tend to be short, stocky, and will benefit more from a stretching program to help with their low back pain. On the other hand, floppies tend to be tall, lanky, with increased joint hypermobility. This demographic requires specific strengthening program to hold everything in place. Myth number 6, rest is the key to recovery from low back pain. In actual fact, bed rest and lounging around on the couch will only lead to increased pain and a slower recovery. Walking and gentle activity is strongly recommended. While it's important to avoid activities that may aggravate the injury, we need to find a nice balance between keeping active and not doing anything to aggravate it. Myth number 7, low back pain is job specific. While it's true that you're at high risk of injuring your lower back doing manual labour, in the consultation room we see just as many, if not more, office workers with low back pain. The primary reason for this is poor sitting posture, muscle inactivity and ergonomics. Myth 8, it is the weight of the object that I lifted that caused my injury. Fact, it is true that lifting a heavy object might be the mechanism of injury for low back pain, but more often than not, it's the straw that broke the camel's back. In other words, it's a cumulative effect. I use the analogy with my patients that when a bridge collapses, it's not the car that drove over it that made the bridge collapse, it's everything else that's happened beforehand. More often than not, acute low back pain can arise from a trivial event such as bending down to pick up the keys or sneezing. Myth 9, as long as I take my medication, I'll be fine. Adequate pain relief is only one part of the jigsaw puzzle. Identification and correction of the contributing factors and a combination of manual therapy, a specific home exercise program, core stability retraining, medication, and activity modification is required to achieve a great outcome. Myth number 10, I'm physically active, so I shouldn't get low back pain. While it's true that well-conditioned individuals are less likely to have an episode of low back pain than the sedentary, some activities have a higher risk of low back pain. These include golf, gymnastics, volleyball, weights training in the gym, even running. And here's a bonus myth. I'm feeling better, so my problem's resolved. Fact, there's an 82% recurrence rate for low back pain. The primary reason for this is because of a loss of your core stabilizers. Core stability is a term that gets thrown around a lot. It's really the interaction of four muscles: the diaphragm, the pelvic floor, multifidus, and transverse abdominis. These four muscles basically work like a cylinder to help stabilize your spine. Clinical research has shown that an episode of low back pain will result in inhibition of the multifidus and the transverse abdominals. If these muscles are not re-engaged, a re-injury will occur. So I hope that dispels some of the myths about low back pain.